Fascia is this kind of saran wrap like coating to muscles. If you can think of a chicken breast, it's got that shiny coating on it. That's the fascia. It's paper thin, but it's also kind of slimy or slippery, and that's because you want muscles to slip by one another and not get sort of hung up. You've ever heard of adhesions between muscles? That's when there's been some injury and now things are not flowing by one another as they should. So that's your connection between a tight hip and having acid reflux because of the distortion to the diaphragm. Also, when you have what's called a dysfunctional psoas, you tend to be somebody who, if this is sort of the normal curvature of your low back, you know, it curves forward, your low back, so you have sort of a lot of curvature. Sometimes this is affectionately known as the duck butt, meaning, you know, your butt sticks out because you have a lot of extra curvature. Well, when you have that extra curve and you can, you know, if you just stand and stick your butt out, you might know you have that just because you can see your posture, or if not, if you exaggerate that, it puts a lot of stretch on the front of you or your core muscles. So when it's chronically in that position and the low back is too curved, it's putting such a stretch on the front of you that your core gets weak. And what that does is it creates increased intra-abdominal pressure, which is one of the leading causes of acid reflux and hiatal hernia, because we've got too much pressure within the abdomen on the stomach, and it gets compressed, it gets forced up, the acid goes up, and off we are to the whole spectrum that goes with that.